the Department of Health and Human Services recently announced a groundbreaking new rule. This rule mandates placebo testing for all new vaccines. This decision marks a significant shift from previous practices. It has ignited a firestorm of controversy within the scientific community and the pharmaceutical industry. HHS Secretary Robert F. Kennedy Jr. has defended the new rule. He argues it is a necessary step to ensure vaccine safety and efficacy. Kennedy points to the lack of placebo-controlled trials for many existing vaccines. He suggests this lack of rigorous testing has left us with an incomplete understanding of potential side effects. This new policy, however, has been met with strong opposition. Critics, including leading medical experts and vaccine manufacturers, argue that the HHS's rationale is flawed. They point to a wealth of existing research that demonstrates the safety and efficacy of current vaccines. This research, they argue, includes numerous double-blind, placebo-controlled studies. The debate over the new HHS rule highlights a crucial question. How do we balance the need for rigorous scientific scrutiny with the ethical considerations and practical realities of vaccine development? The answer is complex and requires careful consideration of all sides of the issue. The HHS has asserted that, with the exception of COVID-19 vaccines, none of the vaccines recommended by the CDC for children have undergone testing against an inactive placebo. This claim, they argue, underscores the urgent need for more stringent testing protocols. However, medical experts and vaccine manufacturers have vehemently disputed this assertion. They point to a substantial body of evidence. This evidence demonstrates that rigorous placebo-controlled trials have been conducted for a wide range of vaccines. These include vaccines for measles, mumps, rubella, polio, and influenza, among others. These trials, they argue, have consistently proven the safety and effectiveness of these vaccines. The controversy over the HHS's claims highlights a critical aspect of the debate. There appears to be a disconnect between the scientific evidence presented by experts and the interpretation of that evidence by the HHS. The use of placebo-controlled trials in vaccine development raises significant ethical concerns. Critics argue that it is unethical to withhold a potentially life-saving vaccine from individuals participating in a trial when a proven effective vaccine already exists. They argue that doing so exposes trial participants to unnecessary risks. The pharmaceutical industry has also voiced concerns about the new HHS rule. They argue that the requirement for placebo testing for all new vaccines, including seasonal updates to existing vaccines, could significantly impede vaccine development. This is because placebo trials are more time-consuming and expensive than other types of trials. Industry leaders argue that the requirement for placebo trials for minor updates to vaccines like the flu shot, which are modified annually to address evolving viral strains, is impractical and could lead to delays in vaccine availability. These delays, they argue, could have serious public health consequences. Despite the controversy surrounding the new HHS rule, there is a consensus among experts on the need for increased funding for vaccine development. The success of the COVID-19 vaccine development efforts has underscored the importance of investing in vaccine research. Experts believe that continued investment in this area is crucial for addressing existing and emerging infectious diseases. However, the increased costs associated with the new placebo testing requirements raise concerns about the potential impact on vaccine affordability and accessibility. Experts argue that it is essential to strike a balance between ensuring rigorous testing and making vaccines affordable and accessible to all who need them. The HHS has yet to clarify key aspects of the new rule, such as the definition of new vaccines. This lack of clarity has generated uncertainty within the scientific community and the pharmaceutical industry. Experts are calling for greater transparency and clarity from the HHS on how the new rule will be implemented and enforced. They emphasize the need for a collaborative approach involving scientists, industry experts, and policymakers to ensure that vaccine development remains both scientifically sound and ethically responsible.